This may sound a little cheesy, but I feel like the universe has put me in the place where I'm at in this moment for a reason.
I get this feeling, oh, you're right where you're supposed to be. The mass layoffs at HUD.
Mm-hmm. Done with a hacksaw.
We didn't see that coming. Housing first, it's failed. Not because it doesn't work, but because it's not implemented correctly.
There is no place that has been able to bring housing first to scale because the resources are not there to do it.
The homeless person cannot fix the affordable housing crisis.
Correct.
Yet they're being blamed for homelessness.
Yes. Individuals are being blamed for things that they have no control over. We have to talk about housing first as a model. And is it the model that has failed, or is it the lack of resources to be able to do that has failed?
And the political and public will is not there.
If people had what they needed when they needed it, we would not see the homelessness that we see.
Today, I am sitting down with someone I have wanted to have on the show for a very long time. Marcy Thompson, Vice President of Programs and Policy at the National Alliance to End Homelessness. If you've ever worked in homelessness or paid attention to federal policy, you have felt the ripple effects of the work Marcy touches. But this isn't just another policy chat. Marcy and I come at this from different angles, but we both share the same end goal, getting people housed and supported. We talk openly about what's happening on the ground, why the public is being misled about housing first, how providers are being blamed for policy failures, and what needs to change right now. If you care about ending homelessness, or if you're trying to understand why things seem so broken, this episode will give you clarity, insight, and maybe even a little hope.
I am excited. I've been wanting to have a sit down with you forever. So thank you for joining us this morning.
Thank you for having me.
Oh, it is an honor. Over the years, I've learned a lot from you. And we have I think we agree, but we come at it from different viewpoints. And I've always thought that would be a good public discussion, which is what we're having here on the podcast. But let's first, who is Marcy?
I'm the Vice President for Programs and Policy at the National Alliance to End Homelessness. I am somebody that's been working in homelessness for about 22 years, which is like exactly half of my life. Started out as a case manager, was a public servant for the federal government for about 12 and a half years, led a technical assistance team for a while, and now I'm on the advocacy side of things.
How do you about that? Do you like being on the advocacy side?
Yes. Honestly, I feel this may sound a little cheesy, but I feel like the universe has put me in the place where I'm at in this moment for a reason, because, so much of my career was focused on either as a federal employee or doing federal technical assistance. Somebody said earlier, I understand how the sausage is made. And so I feel like I'm in a unique position to be able to do the work that we're doing now. I
also feel closer to a destiny, or that this is my destiny, especially when I hate it.
Yes.
When I hate what I'm doing. If you're working at McDonald's or if you're working at Apple, there's probably points that you say, gosh, I'm frustrated today. I hate my job. When you're working in homelessness, it might happen a little more.
Yeah.
And that's when I get this feeling, oh, you're right where you're supposed to be.
Yeah, that's a great way to look at it for sure.
Being in advocacy at this point in time is probably pretty insane.
It's a big responsibility because I feel like there's a lot of people relying on, not necessarily on us as the alliance, but I feel like we play a role to help support the work that's happening in the field. It's a privilege and it's an honor to be able to be in this role and in this position. When you're a federal employee, you don't get to speak as openly or as publicly. And so for me, I'm grateful to be on the side where I can actually, do the advocacy and say the things that need to be said.
People are relying on the alliance, right? And so it's kind of like such a time as this. this. Every day there's new changes. There's
Yes.
new advocacy
Yes.
items, and you have to pick your battles and which one is strategic.
Yes.
And that has to be far more challenging
Yes.
than it was 6 months ago.
Yes, we could be distracted by a million different things.
Right.
There is something new every single day.
Every day.
That we could be, using our capital, for. But we're trying to be really, really intentional. At the core of our work, our accountability is to the field, is to the homeless service providers, is to the continuums of care. And that's who we're representing. Really trying to think about the things that are impacting them the most and trying to do as much as we can there.
And we live in a time that you can't predict it. We
Nothing.
probably can a little bit, but most of it is, holy shit, I can't believe that just happened. Now what we're going to do?
I think that there are certainly things that we anticipated from a policy perspective. I think how things are playing out is catching many people, most of us, off guard.
The mass layoffs at HUD, the federal employee cuts.
Yeah.
We didn't see that coming. And it's going to have a negative effect across the board.
For sure.
Not just homelessness.
Reductions in force are not new, so I think the desire to reduce the federal workforce in and of itself, even if I don't agree with it, that in and of itself is not totally surprising. I think the way in which it's being done with a hacksaw is alarming. There's no way for those making decisions to actually know yet what is or what isn't. So just the lack of due diligence feels scary.
Right. Wisconsin is having an election, and Musk's PAC went in to, support one candidate and attack another, and they attacked the wrong person. Somebody that's not even running that has the same name. They just put all this money in, let's start attacking this person, and they're not even running for election. It's the wrong person. And that's kind of what we're seeing play out. They're just so quick.
I know as somebody that was in government for a very long time, and this isn't specific to the workforce, but just thinking about the conversations around fraud and waste, for example, those require a lot of due diligence to look at a lot of data, to talk to a lot of people, to just make assumptions based on the title of a thing or one piece of data just feels really
it's more of a talking point. And, they're saying waste, fraud, and abuse, fraud, and abuse, all of them. They're like parrots, yet there's no evidence of waste, fraud, and abuse.
Yeah.
How have you seen homelessness change? Maybe even the federal response to homelessness and advocacy. I'll always keep bringing it back to what can we do?
When I started working, HMIS wasn't a thing. The Hearth Act wasn't a thing. I mean, so much has changed.
Wait, whoa. I have a love-hate relationship with HMIS. Oh, my
Yeah.
God. Did you manually collect data?
So I was so low on the totem pole. We were the case management services for what used to be Shelter Plus Care. It is now just COC rental assistance. And so we, had to track what we were doing.
Yeah.
And I actually do think it was on paper that was then submitted to somebody, and I don't even know where it went.
Then they kept it on a spreadsheet or something, and then it just morphed into hopefully a centralized.
Yes. I mean, and I think the continuum of care concept was around at that point, but it wasn't acquired in the same way through the act and stuff. So that was where I started. By the time I got to HUD as an employee, HMIS was in place and things have evolved. But, I was at HUD also during the 2010s. And, that was a really great time, honestly, to be not just at HUD, but to be doing this work because there was so much good energy. We were seeing reductions, across the board. We knew what we were doing was working. And that was still a time when there was strong bipartisan support. There was just a lot of positive energy.
Right.
Somewhere around 2017, we started to see things shift. We started to see the narrative shift. That has been a big adjustment because now it feels like we're fighting on all different
Now, what do you
fronts.
think? Why?
Why has homelessness changed?
2017? And
I think
how did
there's
it start changing in what way?
I mean, I think there's a lot of factors that have probably weighed in, but if you look at the housing market and like wages, and you look at all of the economic factors that coincide with those increases, as we see more and more people becoming homeless and not the same increases in the amount of units that are available, it's inevitable that we're going to see those shifts. And I think that as it becomes more visible, that has certainly played a part in the narrative. It's easier to blame the individuals than to say maybe some of the policy decisions that we've made around housing, around healthcare, at every level of government. It's easier to blame the individual than to acknowledge that those decisions have actually contributed to what we're seeing.
Our producer, Alex, once put in a voiceover, and hopefully I can paraphrase it. You blame the people who have the least power to fix it.
Yeah.
The homeless person cannot fix the affordable housing crisis.
Correct.
Yet they're being blamed for homelessness.
Yes. Individuals are being blamed for things that they have no control over. It's housing, it's wages, it's a broken healthcare system. We can look at the success that the VA has, in veteran homelessness compared to the rest of the population. And you can see the impact that the right resources can play.
As homelessness grows, people are getting frustrated and they're pushing for laws that criminalize homelessness, which will only make the problem worse. Invisible People reaches more people, educating them on homelessness than all other homeless sector nonprofits and campaigns combined. But we do it on a limited budget. We don't have the funding they do. We are mostly funded by individual donations. And now that the economy is struggling, individual donations are disappearing, and we need you. I get it. You might not have the money to donate. Many people are struggling right now. Please share our content, share our videos. It really matters. And if you do have some funds and want to help be part of the solution to solve homelessness, please visit invisiblepeople.tv/donate. Our important work stops without you.
We interviewed Ian yesterday, and he brought up a point that, veterans, and rightly so, he's not saying this are a favored demographic.
Yeah.
Where there's other demographics of homelessness that need that support.
Yes.
And it's just not, the political and public will is not there.
That is definitely true. And, even beyond that, we don't have a universal healthcare system in the same way that the VA does. That is what the VA is.
I never thought of it that way.
Oh, yeah.
You're right.
For everybody else, you've got these providers who are cobbling together. They've got rental assistance from the COC program, maybe some vouchers. They may have this grant over here for services. Yeah. It is very difficult for a nonprofit, for a provider in most communities to be able to have everything that they need.
As I look back, I don't remember even having the conversation about lack of affordable housing prior to 2016, 2017.
Yeah, I think the conversations were definitely happening. Certainly at HUD, we talked a lot about, the fact that we need more housing. We need more housing. We need more housing. I think that the way in which that has crept into the mainstream, it is impacting everybody in a different sort of way.
And then COVID hit. Mm-hmm. And you have much more visible homeless, and you have a population that I believe became filled with fear, which played a part of it. Mm-hmm. Some of them are bad actors, and some of them actually that's what they believe, and they started leveraging against housing for homeless people, just like you would now abortion or gay rights. Mm-hmm. They're using it as a wedge issue, and now here we are.
Yeah. I think, again, it goes back to, I often say, the common denominator for everybody experiencing homelessness is housing. Every single person needs housing, but we also need a lot of other things to help people get back into housing, help people maintain housing, all of those pieces. If you just look at one data point, it's easy to create the narrative that you want to create. It's easy to say, well, homelessness is going up, so therefore what you're doing must be not working. And I mean, I think that is what has worked against us in a lot of ways.
It's not news that I'm all about narrative change, but if, I had unlimited funds, I would do something because right now nonprofits are under attack. And one of the things, and I used California as an example, is the public says, well, you spent billions of dollars on homelessness.
Yeah.
How come that? And then they blame the nonprofits. I know here in Los Angeles and in many communities, they're housing more people than they ever have.
Yes.
Ever.
Yes.
Right?
Correct.
But there's more people entering into homelessness.
Correct.
Which is why the numbers are going up.
Correct.
It's not, mismanagement of funds.
Yeah.
It's the affordable housing crisis continues to get worse. And if anybody wants to argue that that's not happening, we're in Los Angeles that just lost 10,000, 15,000 homes due to fire. And what did landlords do?
Raise the prices.
Raise the prices of rent.
Making it impossible for
Right.
everybody else. Yeah.
Right.
I mean, at the national level, we certainly talk about that a lot. In 2023, almost 19,000 people are becoming homeless for the first time. So we're not talking about folks that are cycling in and out. For the very first time, 19,000 people becoming homeless every week. And then if you look at the number of resources that are available, it is impossible to keep up. Trying to save a sinking ship with a little tiny bucket, that is what is happening when you, as a provider, don't have the resources that you need, and you have lots of different funding sources that you've cobbled together, and they all have different requirements. I mean, it is challenging to say the least.
That's a pretty good segue to what you educated me on, and you knew this was coming. But you educated me because housing first has become a policy. It's failed. Not because it doesn't work, but because it's not implemented correctly. And you explained a lot of the behind the scenes that sticks with me today.
This is a great example of something that someone has a soundbite on, and I'm referring to the opposition really here.
Right.
So Housing First, back in 2013 is really when HUD started incentivizing through the NOFO, encouraging communities to adopt the Housing First approach. When you look at the Housing First model, if you're going for fidelity, there are 5 core components. Housing is just the first piece. Choice, low barrier, but always the goal is that you're meeting people where they are. You're providing them with the services that they need when they need them, right? So it's not about forcing, it's recognizing that people will respond better when it's their choice and you are bringing them along. Unfortunately, that takes resources, and it takes more than just housing to be able to do that.
That's why most of the time the nonprofits are doing the very best they can, but that's all the resources that they have.
I believe that to be true. Of course that there are providers that may have philosophical differences. Of course that might be the case, but I think that by and large, providers do not have the resources to be able to staff in the way that they need to.
Right.
This is why the Alliance has been pushing for increased funding for the workforce. Because in order to meet with your clients on a weekly basis, you need to actually have caseloads that are manageable to be able to do that. And that doesn't exist. We have to talk about Housing First as a model. And is it the model that has failed, or is it the lack of resources to be able to do that has failed?
And that's another messaging educational that I wish I could tackle.
I think the best example of this, the healthcare system that is the VA, paired with the housing. They adopted Housing First across all of their programs in 2012, and that is what they would credit for their success. There's no better example to be able to demonstrate.
Right.
I think you also see it at an individual level when you go to a community and you talk to providers, when they're able to implement Housing First the way it was intended, the success at the individual level is great. There is no place that has been able to bring Housing First to scale because the resources are not there to do it.
And then the opposition uses that against. And the other thing that's happening, I assume this happens in other areas, you have politicians that are pressuring to get housing numbers up because they're under pressure. So all of a sudden a community becomes housing only. You know, they're putting people in boxes, people don't stay in boxes,
Yeah.
and the support isn't there.
I think we have a lot of work to do to be pushing as much for the services as we are for the housing. And I honestly think part of the challenge is, you know, housing is a very finite thing. We say services, and it's, well, what does that mean? Right? I've often heard like, oh, well, that's, you know, mainstream resources are out there. But the reality is there is no perfect resource for those things. You know, Medicaid is probably the biggest funder of services, and that is incredibly hard to bill for if you're a nonprofit, you know, service provider. So in the advocacy space, need to be and are working towards pushing as much on the services as we are for the housing.
You brought up a good point. Tom might have shared this with you. We have a messaging toolkit I've been working on for a long time. You know, behind the scenes, I'm using marketers that are, you know, in the private sector because they understand consumers and behavioral change far better than the ones in the nonprofit sector. And we had very lengthy discussions on, do you say housing first plus services? Do you say housing first plus treatment? Do you say housing plus treatment? I mean, what's the term that the public, and I would like to do more research into that, because housing first is now has such negative perceptions in the public, and the forced treatment, right? Forced treatment is the big push of people that are pushing for criminalization. And so I try to say housing plus treatment because I'm trying to counter all the negative. It's just sad we have to work so hard to even communicate, hey, let's help homeless people.
Yeah, I mean, let's meet people where they are. Social work 101 is meet people where they are, right? I mean, and I think that, to me, that's what Housing First is all about, is getting people into a safe place where they're not dealing with the elements outside. They're not scared for their safety. And you meet them where they are. And, you know, because everybody's starting point is different. Somewhere along the way, I think a lot of things have been misconstrued. I think the lack of resources have, you know, played into that. I think there's also this either or thing that is happening, that it's like either it's housing first or it's treatment first. And there's some other conversation that we should be happening in there.
There's not enough treatment for the people who voluntarily want to go into treatment.
Correct.
So this treatment first thing is just bullshit.
Yes.
It's the people that are against housing first trying to leverage. I don't think they really care. They're just, it's their political leverage.
I mean, if people had what they needed when they needed it, we would not see the homelessness that we see. And that's both for folks that are already experiencing homelessness, but also when folks are still housed. You know, the reality is, I'll speak from my own experience, you know, somebody that has struggled with my own mental health and living in an area that doesn't have an abundance of providers. Like, finding someone that is going to be the right fit for me could take a year. I mean, it is impossible to find. And I'm somebody that has good health insurance. I have reliable transportation that I can go to somebody that is, you know, further distance away. I can pay out of pocket if I need to. So for others who don't have those resources, who don't have the same privilege as me, what options do you have? You know, and so I just think that it is this idea of a false choice because people don't actually have the resources that they need. I remember a White House summit a couple years ago around harm reduction. And there was a panelist who said, this is what I remember, this is not an official stat, but she said something along the lines of, harm reduction is necessary because every day there's a shortage of detox beds of at least 60,000, meaning 60,000 people are showing up wanting to go into detox, and it's not available to them. You miss that moment, and it's gone, you know?
Well, it's recovery plus treatment plus harm reduction plus housing.
Yeah.
That has the best outcomes. It's not just any one of them.
And it's a journey,
Yeah.
right? I mean, like what I need today is not going to be the same thing that I need next year and the year after that. Sometimes in this work, because the need is so great, it's easy to just forget that we're dealing with individuals.
Yeah.
Not that people try to take shortcuts, but I think like we're trying to do as much as we can with what we have. But I think sometimes we all need to take a step back and remember that every single person has different experiences. Their needs are going to be different. There truly is no one size fits all, not just for people experiencing homelessness, but for you and I as well, you know?
In 2010, I was a family case manager and an outreach case manager. They would switch my role depending on the demand.
Yep.
In wintertime, I helped with families. Summertime, I would take a leave of absence and I would drive around the country. Invisible People was at its infancy.
Baby.
But there was a documentary film company that followed me around on one of my road trips way back when. And they did some webisodes. That's what it was called back then.
Okay.
When a couple they followed me going to NAEH, live streaming at one of the conferences and interviewed Nan. These really neat webisodes that actually have morphed into the mini documentaries we do today, because I saw the long form, although it played on PBS a few times, didn't have much impact, but people on YouTube were watching this one particular video, which was on housing first. And the gentleman's name is Lanny. You may have seen it. It's about 5 minutes long. I'll link to it in the description. Lanny, he was blowing a .49. Alcohol level, which is insane in itself. He was retired Air Force. His wife died and he was drinking himself to death. The Glendale police had called us. There's a homeless man in this abandoned building. I was the one who was assigned to go. Found Lanny sitting in his own feces, and I was able to get him a meal, get him a shower, get him a cot, and he left the next morning.
Yeah.
Often case management and outreach is like a shotgun approach. You have so many, but I would try to focus on a few.
Yeah.
And Lanny was one of them. And it took me 4 years to get him into housing. There was times when the homeless services system was ready and I couldn't find Lanny.
Right.
Lanny went into housing and got sober on his own. There was no program, no detox, even though he probably needed it. Once he had a place of his own that provided dignity, and I want to make this clear, there's sometimes people that need treatment and want treatment. So, and that is part of housing first.
Yes.
Don't listen to the people that say it's not.
Yes.
Right? It was a wonderful story, and you said something that sparked my purpose in telling it is, because I already had built this relationship with Lanny, I visited him every day.
Yeah.
Every single day. Sometimes it was just to say hello, and sometimes I'd sit and watch TV with him. Now, the nonprofit that I work for, they would ask Lanny to come to the office once a month. And it's not because they're bad.
That's what they could.
That's all the resource for the amount of homeless people that they had.
Yes.
That's all they could do.
Yes.
I was frustrated, but I couldn't get mad at the nonprofit. They just don't have the resources.
Yeah. I mean, wouldn't it be great if our communities were designed in a way that you could just meet people, again, going back to meet people where they are. Unfortunately, I think with the way that continuums of care set up, you have individual projects, and this project serves this population and provides this thing, and then this one over here does. And so you're always at the mercy of what's available as opposed to what does this individual need and how can I make sure that we have the ability to give them that when they need it. And so I think that scarcity absolutely drives what we're able to do, the policy decisions that are often made. Others will come in and say, oh, something's failing, completely overlooking the fact that there are no resources. And it's not just there's not resources from the federal government, it's the cost of rent keeps going up and the wages
Housing
do not.
stock available, right?
All of these external factors that have nothing to do with the homelessness response systems. All of these other things are broken, and the homelessness response systems are just expected to pick up for all of it.
My concern, there may never be those resources. So this is where we've always had back and forth is, what can we fix with what we have?
Yeah.
I know here in Los Angeles, the housing voucher program, for example, when a homeless person gets a voucher, you're asking a person that doesn't have a car, might not have a phone, or if they don't charge, to negotiate with landlords and find a place.
Right.
Things like that we could fix.
Like, there's always things that we can
We're
improve.
actually always in agreement.
Yeah.
We just say different things.
There are always things that we can do, but often it's a domino effect, right? Like, everybody is, again, trying to cobble together all of these different pieces. They are trying to comply with the rules for this program and the rules from this program. And then they have the state level funding that has its own set of requirements. And by the time you get down to the brass tacks, it handicaps the ability for programs to be as effective, I think, as they could be. In a role that I played where I wrote the federal plan, one of the things that was really important in working on that was, how do we help federal programs work together in a different way? How do we streamline some of this so that at the local level and at the provider level, it's not so complex and complicated that it almost makes it not usable?
Right. I had Brett, who is the director of USC Street Medicine. And there's two people that we documented, a woman in a wheelchair and another one living in a bus bench. Both of them are in housing now, but they were in 5 interim housings to get there. 5.
Yeah.
But here's the catch. A couple of times they got exited back to homelessness as they're transitioning to the new interim housing.
Yeah.
And can you imagine, you have a shower today, now you don't have a shower.
Yeah.
You got meals today, now you don't. What that does to a person.
Yeah.
I know that the service providers would do anything in their power to stop
that from happening.
Right. But for whatever reason, maybe the lease on the hotel, disappeared, or whatever reason, they had no choice but to exit. And we have to fix that stuff.
I mean, I think this is a big part of why it's so important to have people with lived experience and the frontline service providers who are doing the work at every table where policy is being made, whether it's at the local level, at the state level, at the federal level, because I think that you often have, and I'm speaking from my own experience of things that I worked on in the past with really, really good intentions, that how it ends up being executed can be overly complicated, overly complex. And it's all of those unintended consequences that come with the best of intentions. But when you don't have the right people at the table, you're working blind and you don't have that the information that you need to make the best decisions that you can make.
So I have learned, I knew this was going to happen. This is the first time Invisible People in 15 years is targeted service providers. A lot of people are now listening or watching this podcast. What would you tell them? And this is your opening to, give the National Alliance website or whatever, because there's probably local actions, state actions, and federal actions.
Well, first of all, if I'm speaking to the service providers, I'm going to say thank you. That work is the hardest work that exists. It takes a really special person to be able to meet people in their most vulnerable state, be able to help them navigate through that. So I would say thank you to that. In this moment that we're in, we don't have a whole lot of tools, but the one tool that we have is our voice, is advocacy, and, being able to, at every level of government, to be able to talk about what you actually need. Not just like, this isn't working. What would work? What do you need? Be prepared with data and with outcomes, and, all of those things matter.
And stories.
Absolutely. No, I mean, I think that you need all of those pieces. If you're talking about federal legislators, they need to hear from us every single day. They need to hear from every single person that is doing this work every single day, because they have a million things that are coming across their desk. We want them to remember us. We want them to, be so annoyed. Yes.
Squeaky wheel gets the grease.
Exactly. So for folks that are not already hooked up with the Alliance, you can go to endhomelessness.org, go to our Take Action page, and you can sign up for our advocacy alerts there. I often say my job is to be the facilitator of, I'm not the expert, but I want to bring and make sure that we're bringing the experts in informing what we're able to do, using the position that we have as a national organization to get into the doors that we have access to, but bringing everybody along into that work with us.
Well, it's been wonderful. Thank you very much for talking to me.
Thank you for having me.